Hello, welcome back to my YouTube channel. For those who are visiting this channel for the first time, I would like to introduce myself as Dr. Rocha with specialty in mental health nursing. Recently, I have been making different videos on different mental health disorders, their medical as well as nursing management. Before you could proceed, if you haven't subscribed my channel, please do subscribe and share to others, as it would be useful for you as well as for them. So for today we are going to discuss about suicide and its prevention. And before we could go into the topic, I would like to just share with you regarding Suicide International Association for Suicide Prevention, as well as WHO has declared September 10th as Suicide Prevention Day, World Suicide Prevention Day. And the theme keeps changing every 2 years. And for that, we have this year theme is changing the narrative of suicide. And why I would like to just have an introduction before we could go straight away into this topic is that I just want you to go through some main points which the president of International Association of Suicide Prevention has given. So I have highlighted some of the sentences here which are given and would like to read them for you so that you will have some awareness regarding the suicide prevention campaign. So they have stated that suicide prevention is a collective responsibility, and together we can create a world where every life is valued and supported. As we focus on changing the narrative around suicide, I encourage you to use this campaign pack to spark meaningful conversations, foster connections, and drive impactful change. Your dedication and collaboration is vital in this mission. So, this is the message which is given by Professor Rory, the president of International Association of Suicide Prevention. If you just look at the statistical point of view, it's just to have an overall idea that it is estimated that every year we have more than 7 lakhs of suicides. And that's the reason this is an important issue which is burning, or it's an important awareness which it has to reach globally, that suicide is preventable and that we can prevent it if we have awareness regarding how to prevent it. So this is what I wanted to share to you, and now we would move on to suicide prevention. Suicide prevention is a very important topic, and please do just focus as you listen to this. It's not only just as a topic for an exam point of view that we need to go through this, but also we need to have some responsibility, and we do share the burden which is all on our shoulders to prevent suicide. As said before, that suicide can be prevented. So we can see here that suicide is defined as an act of deliberately killing oneself, while suicide behavior refers to the behaviors ranging from thinking to suicide, planning of suicide, attempting suicide, and suicide itself. So, act of deliberately killing oneself, as well as suicide behavior refers to behaviors ranging from thinking about suicide, planning for suicide, attempting suicide, and suicide itself. Suicide is preventable. If we take Indian countries, it is highest in the number of suicides. Worldwide, if we just take the census point of view, every third female suicide and every fourth female suicide occurs from India. This is something serious to be taken, isn't it? Every third suicide and every fourth suicide occurs in India when we are comparing globally. So, coming to etiological factors, suicide is listed as a non-communicable disease and has multifactorial causes as to most other non-communicable diseases. Coming to common misconception that suicide occurs only in mental illness, no, it's a misconception. Because it is multifactorial and suicides can occur during financial stresses and financial stress. Maybe you can just think like when we have financial stress, it is like loss of jobs, debts or business failures and agricultural losses, all these things. Relationship stress. Relationship, maybe faulty interactions or family problems between husband and wife, family members, in-laws, parents, children, child abuse or trauma or relationship failures. And next, another important factor is academic failures. Like we see many youngsters during their intermediate period or university, they fail with the fear, they attempt suicide with the fear that they are going to fail in their exam. School dropouts, inability to tolerate the stress in the education, through the education system. Then apart from that, we have physical illnesses, especially chronic illnesses, pain, cancer, or financial burden which they face for treatments. Some surgeries, they cost them lakhs of rupees, and when they can't afford, they go into depression, then attempt suicide. Then some illnesses where stigma is attached, for example, like HIV and tuberculosis. Then other causes are like depression and alcohol, where persons, especially alcohol, when we take like alcoholic addicts, where they have lost certain relationship with the family members, as well as loss of health, as well as loss of social support. So these are some of the etiological factors which precipitate a person to commit suicide. Coming to suicide risk assessment, a commonly held belief is that it is hard to know when someone is thinking about committing suicide. However, people thinking about suicide frequently show warning signs for many days, weeks, and even months that can easily be identified. So, we can identify persons who are around us, who are expressing their thoughts, that they feel like ending their life and all, and those things should be taken seriously. So those are actually considered as warning signs. They are not directly associated with suicidal thinking, so they can be missed. Like warning signs, we are going to go through them in detail. By knowing what these warning signs are, we can prevent them. So the first step of suicide risk assessment is involving or identifying the warning signs. We will just see regarding different warning signs. We have verbal signs and behavioral signs. Talking about ending life. Someone telling, I sometimes I feel like dying, I don't want to leave. Someone talking about feeling guilty or have committed a sin, that is a warning sign. Talking about feeling hopelessness, or telling or expressing that they have no reason to live. Talking about feeling trapped in unbearable pain, this is mainly related to chronic illnesses. Talking about being a burden to others, this is mainly when they are dependent on other persons. These are some of the verbal signs you need to be cautious about. We have behavioral signs. Suddenly starting alcohol use or drinking more than before, or using some substances. This is also a sign that they are having some problem. And other behavioral problems is like being restless, agitated, getting angry, anxious, easily worrying. And apart from that, feeling sad and dejected or rejected, sleeping too much or too little, withdrawing themselves, isolating themselves, avoiding parties, or decreasing their communications with friends and family members, showing extreme rage or anger or seeking revenge, displaying extreme mood swings, suddenly crying, reckless, hyperactive. And we have preparatory behaviors. You should be very careful with these preparatory behaviors. A person, when he wants to end his life, they want to give away their belongings, possessions, medicines, then their properties. They start making wills. So each of this, they try to gather some items through which they want to end their life. So these signs, each sign, whatever it is, either it may be verbal sign or behavioral sign, has to be considered seriously. Now, some of the risk factors for suicide, there is, as we said, it is multifactorial. No single cause for suicide. Suicide results from combination of factors. So we have looked at some of the warning signs. Now we will just look at protective factors for suicide. These are the factors which can reduce or decrease the risk for suicide. Protective factors are those factors which can reduce or decrease the risk for attempting suicide or committing a suicide. The greater the risk factors and the fewer the protective factors, the risk increases. And we are going to see the risk of suicide also, basing upon the warning signs as well as the protective factors. Some of the protective factors are like good family support, friends support, and colleagues support, and easy local availability of friends or hospitals, support from counselors and doctors. These are protective factors. Ability to resolve problems and difficulties in relationships. This is an individual factor where a person himself has this ability to resolve any difficulties. Then we have cultural and religious beliefs, where when we face any problem, we try to ask God's help. So these are some protective factors. Apart from that, some risk factors, like in society, access to means inappropriate media reporting is there, stigma associated with seeking behavior. Then coming to community, we have some risk factors or risk areas where we can consider them, like disaster, war and conflict precipitates, stresses, discrimination, trauma or abuse. Then regarding relationships, we said isolation and lack of support, or conflict between the partners, conflict within the family, or marital discord, or loss of a partner. Coming to individual factors, previous suicide attempt is a risk factor, mental disorder is a risk factor, harmful use of alcohol is a risk factor, job or financial loss, hopelessness, chronic pain, family history of suicide, genetic and biological factors. All these factors are again considered as risk factors. We have seen warning factors, we have looked at the protective factors, and these are some of the risk factors, society wise, community wise, relationship wise, as well as individual wise. Now, coming to intervention management, it is important to remember the risk categorization done basically on equating the number of risk factors and protective factors present in the individual. So previous slides we have seen about the warning signs, and the next risk factors and protective factors. So we can categorize them according to their presence. So the main aim of this intervention plan includes crisis management, make a safety plan, and refer the individual to the trained personnel where they can counsel them. First and foremost, try to help the client to express their suicidal thoughts freely by being a good listener. Now, coming to our nursing, usually we have 3 levels of prevention: primary prevention, secondary prevention, and tertiary prevention. In primary prevention, we mainly focus on preventing the suicide by identifying the risk factors or warning signs, which we have previously seen. Anyone who just has these warning signs, some interventions, what we are supposed to do is be a good listener, allow the person to ventilate, speak out, do not interrupt in between, listen to their problems attentively and understand their problems. And when they talk, cry, shout, vent up frustration or whatever it is, respect them and be non-judgmental. Show non-judgmental attitude and try to understand the person's point of view and their thoughts and feelings, because they might not share with whomever they feel like. Only if they find a person on whom they can trust and be confident, to them only they'll share. The next point we have to do is be supportive and instill hope in them. Next one is building a contract. So here we are going to take a verbal contract from them, a promise that they are not going to do or commit any suicide till we find some help for them. So we are going to take a promise from them. Next, we are going to see crisis intervention. So as we know, as a part of an intervention, crisis plan has been devised, and this plan varies from individual to individual. If they go through, this might be helpful for them. Here are few strategies which are just listed above, how we can come out of this suicidal crisis. It is a preventable cause of death, we can say. We have been telling that. And suppose if we land up into a crisis, or if you see any person in this crisis, you can advise them on this, like distract themselves from suicidal thoughts by involving in activities which will bring some pleasure to them or hold some personal meaning for them, like painting, drawing, shopping and all. Then asking them to involve in physical activities like walking and exercising, which can improve their mood. Then write down their thoughts in diary. Repeat to themselves or yourself that I am not going to hurt myself. Then call to your confident means a person whom you can trust. Share your problems. Can call to a counselor and talk to the person, or any crisis, suicide crisis helpline centers are there, and we can approach them also. Next is a safety plan. A safety plan helps in reducing the risk of an individual at risk and keeps him or her in protected environment. So environment protection, when we see, reduce the access to lethal means. So when a person has an intention of committing suicide, maybe they will choose different methods like uh, drowning themselves or poisoning themselves or hanging themselves or using gun to shoot themselves or whatever it is, using knife to cut themselves. So reduce access to the lethal means these should be removed from the environment. Tablets, poisons. And identify a confidant means identify a person whom you can trust, who can be very confidential about the information what you speak to them. Negotiate with that person, and to how much you can trust that person, you can assess and share with that person whatever concern you have. Then accessibility. In accessibility, we are going to provide numbers of suicide helpline centers or toll-free numbers and other crisis helpline centers. These can be any health workers as well. So you can provide them with this opportunity where they can just call when they're feeling depressed or lonely. And the next one is follow. Ensure that the person at risk has reached to the hospital or a referral center or home and is under observation. Now, coming to the risk level, there are three levels of high risk, moderate risk, and low risk. So, how we can categorize the risk level is that first one, the risk, suicidality, and possible interventions. High risk, person suffering with depression and other psychiatric illnesses are considered as high risk. Next, the triggering events, absence of protective factors. Coming to suicidality, if they have made any lethal attempt, then high risk. Recent suicidal attempts, high risk. Recurring thoughts about suicide, if they say that they're having recurrent thoughts about suicide, then they come under high risk category. For such a type of persons, admission to hospital setup is recommended, immediate admission, then removal of access to the lethal methods, and apart from that, close supervision is needed. Next high risk is moderate. So here the person has multiple risk factors as well as he has few protective factors. So they might be having an ideation with a plan. So here also in moderate risk, admission may be necessary. You can develop this crisis plan for them. Then frequent observations. Coming to low risk, few risk factors we can see and strong protective factors. They might be having thoughts of death but no plan as such. So these persons can be referred to outpatient department. They can meet a counselor or a mental health professional where they can be guided and where they can be provided some counseling. Thereby we can just prevent suicide. How to refer? Explain the need for referral whenever you identify, whether it is a friend or a confidant or a trustworthy person, whoever it is. Uh, when they identify, they're supposed to bring them to the hospital. And from there, if we are working at a community area or a primary centers or at sub-center levels, so we need to explain the need for referral and try get permission and identify the person and see that the person gets admitted. The next one is make use of available resources like family, friends, relatives, colleagues, and other healthcare professionals. How you can refer a person. Then next one is you can directly call for an appointment, inform the psychiatrist in the hospital about the person whom you see at risk, and ensures that the person has reached the hospital to the referral hospital. Contact the person after consultation and maintain periodic contact with the person. These are some major points. And regarding follow-up care and frequency and follow-up assessment at primary care level, when they get discharged back, ensure that they are adhering to the treatment part of it. Then monitor for suicidal thoughts, plans, or any wishes. Then monitor for depressive symptoms. Then distressing if they have any types of hallucinations or thought disturbances. Then first follow-up should be done closely by 2 weeks after discharge from hospital. Then frequency of follow-up depends upon the clinical status of the patients. Inquire about return to adequate biological, social, and occupational functioning, whether they are able to go for their work and do their normal activities. If there exists severe depression with psychotic symptoms and all, then you have to again make a license between with district mental health team as well as medical college or psychiatrist and refer them for further care. So this is all about suicide, and I would like to recap this before I could end this. We have discussed about suicide. It is a preventable cause of death, and suicide is a deliberate act of killing or ending one's life. And we have seen that the etiology of suicide is multifactorial, and there are certain risk factors. We have some warning signs where we have verbal signs as well as behavioral signs, and we have risk factors as well as protective factors. The more risk factors, the more risk for person committing a suicide. The more protective factors, the lesser the risk. And we have seen different strategies and how we can management and how we can prevent suicide, and what type of care needs to be provided for the person who is having the intention of committing suicide. I hope this video would be helpful for you. Thank you all very much for listening. And before we could end this video, please do share and subscribe this channel. And thank you all very much. We'll meet again soon.